Okay, continuing from where we left again. So we were discussing the various causes of ectopic pregnancy in answer to the question if the patient says, why did it happen to me? And we discussed different causes, and in a small proportion, other causes like having IVF performed or ICSI performed, or if the age is more than 40 years, and if there is positive smoking history, these factors may also increase the risk of ectopic pregnancy. Okay, let's see. Now we come to the management of the patient. Okay, and this is very important in this scenario. Okay, now we had two situations. One was when the consultant has already decided that a laparoscopy would be conducted, and another situation when decision has not been taken yet. Now when this decision has already been taken, it's clear you have to focus on the surgical management. Okay, you describe the surgery, you describe the laparoscopy in detail, the complications of laparoscopy, and how to manage those complications. So you're going to go into the surgical options in detail. Okay, later on, if the patient wants to know that what are the other options apart from surgery, then you can explain the other options as well. Now if no decision has been taken, then again also it's straightforward. You have to tell her about the possibilities, okay, and why those treatment options are chosen. Okay, now you tell the patient that the treatment, the choice of any method, basically depends on two main things. One is a hormone inside a female body which is called human chorionic gonadotrophin hormone. In short form, we call it HCG. Okay, and that is present in our body, in a lady's body when she becomes pregnant. Okay, and the other method on which the treatment depends is the ultrasound findings. Okay, so both ultrasound findings have been done on her as well. Now, another important piece of information is that you tell her that because an ectopic pregnancy cannot lead to the birth of a baby, all treatment options basically end the pregnancy in order to reduce the risks to the patient's health. Okay, this is something you need to inform the patient about, and that the most suitable option for you depends on these factors: the HCG, the ultrasound findings, as well as the symptoms that you are experiencing. Now, what are the different options that we have? Basically, so we can go for conservative management, for medical management, and surgical management. So let's go through each of them one by one. Now, if you're talking about the conservative management, it is also called the expectant management or wait and see. Okay, so you can tell the patient that the first type of management is actually conservative. It is also called the expectant management. That means we wait and see, or you can say that we let the nature take its course. Okay, now what happens here is that your condition is carefully monitored to see whether the treatment is necessary or not, and this approach, the conservative approach, is suitable if the HCG over a 48-hour period is decreasing spontaneously and the woman remains asymptomatic. Okay, in that case you can wait and see what happens. You let the nature take its course. So you explain to the patient that if you have no symptoms or mild symptoms and the size of the pregnancy on the ultrasound is very small, or it can't be found, you may only need to be closely monitored because there is a good chance that the pregnancy will dissolve by itself. Okay, what you will have done is your regular blood tests, in order to measure the levels of this hormone HCG in your blood and to make sure that these are actually going down. And these tests will be performed every few days until the hormone is no longer found in your blood, which means that the pregnancy has dissolved by itself. Okay, now during this period, you might have some bleeding, vaginal bleeding, and we advise you, or I advise you, to use sanitary pads or towels during this bleeding. Okay, avoid using tampons until this clears up. Apart from bleeding, you may also experience some tummy pain. You can take over-the-counter painkillers, paracetamol, to relieve this pain. Okay? The main advantage of monitoring of this conservative management is that you won't experience any side effects of other treatment like medical treatment or surgical treatment. However, in certain cases, there may be a risk of rupturing of the tubes only if the HCG levels are not coming down or if the size of the pregnancy is increasing, okay, which we will keep an eye on. That's the main aim of observation. Okay, now another important thing to say to the patient at this point is that if you experience more severe symptoms, if the symptoms get worse, if you experience heavy bleeding, if you have a very severe pain, if your pain gets worse, please come to the hospital immediately. Okay, you will be given the contact details, so you come to the hospital immediately, or you contact the hospital immediately as soon as your condition worsens. Okay, what else? So expectant management is basically not an option for all the women. Okay, as I explained to you before as well, it is only possible when the pregnancy is still in the early stages and when you are experiencing mild symptoms or no symptoms at all. Okay, some women who are on conservative management, they may require additional medical or surgical management as well, depending on how their pregnancy progresses. Okay, and then after this we will talk about the medical management and the surgical management.